let's talk about ADC. It's Australian Dental Council exam. It is a pathway if you want to work as a dentist in Australia. So these are the 3 stages that every overseas trained dentist has to go through in order to practice as a dentist here in Australia. The very first is initial assessment, then comes your written exam, and the final step would be a practical exam, after which you can actually register here as a dentist and then can start working. Let's understand what is initial assessment. So usually it's all the paperwork that is needed. So you have to collect all your documents, mostly your degrees, your clinical hours, and then, of course, attestation and all that. Okay, your good standing certificate, everything should be there. And usually it takes 6 to 8 weeks. That's what they say. So if you go to adc.org.au, there is, and if you select, pathway for dentist, you can actually go there. If you click on initial assessment, you can actually follow all the steps. And if you follow all these steps, then only they take 6 to 8 weeks. Otherwise, of course, there would be some hindrances during that initial assessment as well. And that's what happened with me as well when I was in Malaysia. Just be very precise what they want in terms of documents. Once you are done with initial assessment, as I said, it might take 6 to 8 weeks, then you can actually apply for your Part 1 exam. So Part 1 exam, guys, is basically a written exam where they are going to check all your theoretical knowledge. So it again happens over 2 days. The good thing about Part 1 is, because Part 1 is conducted all across the world, you can actually appear for Part 1 from anywhere. So even say, for example, you guys are in India and you are done with your initial assessment, but still you can appear for Part 1 in India. So there are many centers, and then the format is simple. So they give you a scenario. Mostly around that scenario, then they give you some MCQs and scenario-based questions. But the thing is that there are 4 papers in Part 1. So 2 papers on day 1, 2 papers on day 2. And you have to clear all papers in one sitting if you want to succeed in this Part 1 exam. And again, the results are based on percentile basis. So if you want to know how to prepare for Part 1, it's, to be honest, simple. It is overwhelming, but you have to just study smart, but not really hard. So you have to use all the high yield resources. As I always say, even if guys, if you have seen my videos or you know me, I actually emphasize a lot on the therapeutic guidelines, because here in Australia, they just treat it like a Bible. So you have to memorize, you have to know everything in and out, whatever is there in therapeutic guidelines. And then definitely solving a lot of SBQs and MCQs on a daily basis, it's definitely going to help you a lot. And I would say solving past papers and repetition, repeating and solving it back and forth is definitely going to help you in the long run. So my go-to resources are therapeutic guidelines. That is, I'm not talking about all the therapeutic guidelines, but the oral and dental one. Then Odell's Clinical Problem Solving in Dentistry textbook. If you can go actually and do 1,000 MCQs for the dental exam, that would be good. There's again some books, some special books, which here they treat as like, more obvious, and they just want, aspirants to go through it completely. Cameron Handbook of Pediatric Dentistry is one of those books. Then again, for radiology, it Langlis and ADC past papers, as I said, are a must.